Good evening. My name is Sarah Torellis, and this is going to be my OB service learning project during the accelerated program. My service learning project was during the Diabetes Week that was on June 7th, 2026 from 1 p.m. to 5 p.m. And it was at Camp Aldersgate, and hopefully I pronounced that correctly. They are located at 2000 Alders Creek Road in Little Rock, Arkansas. It was sponsored by the American Diabetes Association. Camp Aldersgate is a non-profited camp and retreat center that provides recreational and therapeutic camp experiences for children and adults, which I thought was pretty cool. I talked to one of the directors there, and she was explaining to me that they have a young adults camp that is for young adults from, well, I guess older adults too, but from the ages of 19 to 40 years old, because their regular camps go age out at 18 years old, and then there's nothing for people. So they did create a young adults camp. This is for special needs clients that have chronic health conditions. This camp focuses on providing a safe and supportive environment where the campers get to build independence, they get to build confidence, they get to have social connections, all while they're participating in regular traditional camp activities like you and me would go to. One of the SDOHs that is related to this population is the social and community context, which is identified by the Healthy People of 2030. This domain focuses on how relationships, community support, and belonging influences health outcomes. Children attending the Diabetes Week benefit from the supportive camp environment where they get to interact with peers that also live with diabetes. This helps them reduce the feelings of isolation. It builds their confidence, like I said before, and it encourages emotional well-being while learning self-management skills. There are other resources in the area that help with children and adults that need management for management for diabetes. And one of those resources is the Arkansas Diabetes Prevention Control Program. And this is at the Arkansas Department of Health, which is located at 4815 West Markham Street in Little Rock. This is a state public health program that focuses on diabetes, education, prevention, and community outreaches that provides resources for families, has school programs and public health initiatives that promote healthy eating, physical activities, chronic disease control management. It helps connect families with diabetes education that is outside of the hospital settings and supports long-term disease prevention and self-management. Another resource is the Arkansas Children's Hospital, which has a diabetes center, and I thought that was pretty cool. Just thinking that the Children's Hospital has it, but also Arkansas Children's is the only children's hospital in the state of Arkansas. So that's pretty cool. They are located in Little Rock, Arkansas, and they're at One Children's Way. They specialize in pediatric health care programs that provide comprehensive care for children and adolescents living with diabetes. Their services includes insulin management education. Bear with me when I say this word because I struggle. Blood glucose, monitoring support, nutrition counseling, school care planning, family education to help children manage type 1 and type 2 diabetes effectively. It assists. So, while I was there at this camp, I did get to assist with life checks for campers that were 7 to 14 years of age. Doing this, it helps promote this a safe and healthy camp environment by preventing the spread of lice among campers. It showed me that even this small, simple task like performing these checks play an important role in prevention and protecting the vulnerable population. This experience helped me see how much of a difference a supportive environment can make for children living with diabetes. At Camp Aldersgate, I did observe how comfortable the campers became when they were around peers who understood the exact same thing that they were going through. And that is very beneficial and helpful, especially think about it if you're a 7-year-old and you just started going to school and you have friends that don't have diabetes and you haven't been outside and to find out that you're not the only one. So seeing other kids in your age group that actually have the same thing makes you feel like you're not left out. It made me realize that managing a chronic health condition is not just about medical care, but it's feeling accepted and supportive. I also gained a better understanding of how public health programs and pediatric diabetes resources work together to support children beyond the healthcare setting. And this is my video, and I hope you guys enjoyed it. Thank you.